Michelle, what is being in the Victorian? What does that entail? How long is it? What is required?
Our program is a minimum of 60 days. Most of our women end up staying 4 to 6 months because we have a step-down transitional program. When we're talking about treatment, I think it's really important to understand that this is a disease of shame. This is one of the most shameful diseases out there, more so than substance abuse addictions. So in order to treat them, it needs to be a shame reduction model. So that's what we use at the Victorian. It's a non-punitive based treatment facility. Okay. These women come in broken, so our job is to empower and to build them back up.
And what are some of the things you do? Is it all discussion? I mean, I know you have certain therapies.
It's a full milieu of different treatment different treatment services, excuse me. So we use individual therapy, we use process groups, group therapy, as well as neurobehavioral learning and neurofeedback. Which is a really fascinating new treatment that I think will be everywhere here shortly. We also use intuitive eating as a base. So as the women come in, they're meeting with the dietitian. When they sit down with the dietitian, one of the first thing that she says to them is, how can I help you achieve your goals? So super important to be empowering the women and bringing them literally and figuratively into our treatment team. So they're starting with measuring out all of their own foods. And then once they have that down, usually about a month, depending on what, of course, eating disorder they have, then they would move to reverse measuring. Well, now they are putting the amounts of food on their plate and seeing what is their eating disorder telling them about that portion. Is that portion way too big or is that portion way too small? So once they get used to reverse measuring and they have that down, then they move to intuitive eating, which is hopefully how all of us here today eat. So it's a process and it does take time, and that's okay.
Yeah.